Hello, we are the Knowles Insurance Agency, husband and wife team, Richard and Samantha Knowles. We've had the great privilege of serving our clients for over 16 years. We're heading on 2 decades of service. Yay! So, I want to talk about lowering your Medigap rate today. This is for people who have been on a Medigap for 2, 3, 4, 5, 6, 10 years and have received rate increases. And I want to talk about how you can lower your rate, hopefully today. If this is the first time you're watching one of our videos, I like to remember to kind of summarize things. A Medicare supplement and a Medigap plan, those are exactly the same thing. They're offered by private insurance companies and they help you pay for lingering costs, stuff that's left over after original Medicare pays. Your red, white, and blue Medicare card, it's got your name, your gender, your Medicare ID, and then it's got an A hospital and a B doctor. Those two things together do not cover everything. There's gaps and deductibles, and there's 20% coinsurance up to no maximum. So people minimize their out-of-pocket costs by filling in the gaps, some of the stuff that Medicare doesn't cover. And one of the ways is a Medigap plan. I'm going to show you a chart here in just a second. Here is a quick Medigap chart. I believe it's page 70 of your Medicare New 2019. But this is a list of all the standardized Medigap, Medicare supplement, same things, all the plans that are available. And the percentages clearly show you what they fill in the portions of Medicare A and B that are not covered by that red, white, and blue Medicare card. These plans show what levels of cost sharing they fill in. So that's your Medigap chart. So remember, your Medigap rate started out pretty low. And upon your renewal date, also called an anniversary date, the company may raise your rates. They do raise your rates. Factors are age, cost of living, inflation. There's different factors, different reasons that an insurance company can raise the rates. But usually within the third policy year, I always tell people, it's a really good idea to shop around. Your first year, you got a very low rate increase. Your second year, now you're in the third year, that rate has gone up. Remember, it's easy to shop around because these are standardized Medigap plans. So if you have a G and you look around at another company with a lower premium G, you're going to have the exact same plan. These are standardized. There's no network changes, no doctor changes. It's going to be exactly the same benefits, and you do not have to ask your doctor if they take the new insurance company's plan. If they take your current insurance company's plan G, they'll take any insurance company's plan F, plan G. Also, do not wait until the end of the year during the annual enrollment period from 10/15 through 12/7. That's for Medicare Advantage plans and drug plans, and that is such a highly congested time. Do not try to lower your Medigap plan during that period of time. It's going to be crazy. You can do that now. So now, to lower your rate, you're now subject to medical underwriting. Scary. No. Medical underwriting is the process of assessing the risk associated with providing health insurance for an individual. It involves the review of your health history, your medical information. We have to talk about your drugs. And basically, all that is used to determine how risky an individual is to insure and thus how much the insurance company should charge you. So it's always based on your current health status. Now, if you try to lower your rate and you get declined, it's really not that big of a deal because you just stay committed to your current plan. Do not assume you are uninsurable. It might be a waiting period that you have to wait. Give us a call for a little education on your specific situation. And I'm going to go over some health questions and give you some very specifics, but I have people that say, oh, I've had cancer, I'm not insurable. Oh, I have heart issues, I'm not insurable. Not necessarily. I've got an individual that has cancer. And I don't know the name of it. I don't remember the name of the cancer, but he is not in remission. So it's still an active cancer. But in his doctor records, the doctor has stated that the degree of intensity, the probability that this particular disease is going to put him into the grave is 0. Guess what? We took a $300 a month premium and we lowered him, I believe it was down to like $125. He was insurable. Now we had to get favorable documentation from the doctor, evidence to back that up and to prove it, but do not assume you are uninsurable. Give us a call. So all companies have a height and weight chart because, again, these are fully underwritten plans. They take into consideration your stature and your weight. So again, this is a sample height and weight chart. So here is our sample set. And again, we have over 30 different companies. So there are companies that will take some of the major chronic conditions, but the lower premium plans perhaps do not. For example, at the top, if you'll see, number 12, at any time have you been medically diagnosed, treated, had surgery for? So this is ever in your whole life. There's chronic kidney disease. It's got to be stage 3, 4, or 5 kidney failure, dialysis. And you've got some big things, some emphysema, some cardiopulmonary disorders. It's got to require oxygen. We've got dementia, cognitive, Alzheimer's. We've got Parkinson's, MS. We've got lupus. We've got chronic hepatitis, cirrhosis. So you can see these are some pretty big things at the top. And then we have some time frame health questions. Number 17, within the past 2 years. So literally we are speaking of 24 months. Been treated for, advised by a physician to, have treatment for. And as you can see, the first 2 are lots and lots and lots of heart. Angioplasty, heart attack, heart failure, congestive heart failure, atrial fib, keep going. All sorts of heart. Implanted pacemaker is 24 months. Alcoholism, drug abuse, mental nervous disorder, you have to require some hospitalization. And then there's internal cancer there. Those are 24 months. There's also a health question at the bottom, which I don't even believe I put in there, but it's a pending question. If you're in the middle of anything pending, if there's any future diagnostic testing evaluation that has not been done yet, anything pending. So again, pending. So again, give us a call and we'll review your health status and then we'll know how to proceed. So those are just a sample list of health questions. When you give us a call, what we'll do is we have software and we have over 30 different insurance companies. So we'll take your date of birth, your zip code, your county, smoker or non, and apply a household discount if you can get that. And we will go and run you the lowest rate. And then we'll discuss that and we'll send those specific health questions. So the whole process of lowering your rate could take as low as a week. Some companies might take a couple of weeks. But basically, the process is so easy. We have a conversation, we review the health questions together, we determine, because if you talk to me, I'm going to tell you if you're going to be insured or not. I've been doing this quite a while. So we determine that we want to submit an application. We submit that. The company reaches out for a phone interview. That's the next step in the underwriting process. That's between you and the insurance company, not us. And you give them information over the phone on a recorded line. That information, all along with your application, goes to underwriting. They underwrite you. If they need any verification or documentation, favorable docs from the doctor, we'll work on that. That's not very common. But within usually less than a week, we will know if you've been accepted on a lower rate, with a lower rate. So it's really a painless process, and there is no application fee unless you get approved. So literally you're losing nothing by trying to lower your rate. So give us a call. We'd love the opportunity to serve you and put money into your pocket.